get started. Okay.
Yeah.
Great.
Oh, all right. Thank you all for being here. Let's see, I'm gonna share my screen again. Oh, okay. So I am beyond excited to share what I've been thinking about and working on for the last 5 years of this dissertation. And I wanted to start off with, saying welcome. I'm so excited to see so many former colleagues, tons of dear friends, all of you in the room here. Just feel tremendously supported. Today's talk is the first time I've actually shared this research in its entirety. It's the first time I'm really telling this story from start to finish. And this is truly an opening. All of you on this line, many of you are global health experts or human-centered design experts. And so this truly is a defense, but it's also really saying, bring on the critique, bring on the conversation. We all learn from that, and I'm excited for that. This is also a teaser of my full dissertation. So you are now all invited to be VIP reviewers. I really want more eyes on this work. There's a lot more to go. And I will have several months to finish writing. So again, this truly is an opening. One of my goals of this talk is to really stoke collaboration and to try to think about how to extend and disseminate this work. So keep that in mind. And at the end, there'll be a 20-minute Q&A. And so this is my invitation and my begging to nerd out with me, really get into this, ask questions. I would just love to hear what you're thinking about or what this stirs in you.
Good. Drag them over to the other screen.
Not that
Can you drag them onto your laptop?
You can hide the video.
Oh yeah, thank you.
Yeah.
Okay, thanks.
Then hide it.
Hide floating.
There we go. Thank you. It's been a while. All right, so the title of my dissertation is Applying Critical Reflection to Reimagine Global Health. And I'm going to start this by saying I am really lucky. As you all saw by the map, so many people are tuning in to see me from all over the world. I've lived in many places, I've worked in many places, I've traveled all over. I'm a really lucky person. And I was born into privilege. I'm a white American female living in the 21st century, and I have tons of family support. And what does that look like? I've gone to private school throughout up until my master's degree in public health. That expanded me to a ton of cool jobs and a huge network working at CDC, starting as a volunteer coordinator for Partners in Health, and then moving on to be a director for the Partners in Health data and informatics team at both Malawi and Liberia. And when I got to Liberia, I met a lot of people from the University of Washington that I had been scouting out and pining over to try to go to. And that really opened the door for me to apply to this PhD program in human-centered design, and I also applied in implementation science. And when I started at UW, this just opened way more doors than I could have imagined, including to mentorship and consulting and internships. And truly, just being a student again was really, really wonderful. And then it helped link me to my current work, where I work now as a senior digital health specialist at a nonprofit that's based at the University of Washington that supports digitization of healthcare. So my experience shapes how I see the world. And this idea is that I have situated knowledge, what I define as knowledge, what I choose to implement, how I choose to implement, what I select to study, all of that comes from my experience and now how I see the world. And situated knowledge comes from feminist theorists, and I love this quote, that no one group has a clear angle of vision. No one group possesses the absolute truth. In other words, my view is so situated, and there's so many different ways to see and experience the world. There are so many different forms of knowledge. So my PhD studies made me hyper aware of my situated knowledge, and it made me begin to think about whose knowledge is prioritized and how that determines what we decide is knowledge, what to implement, all the things I just listed. This also made me think about how knowledge prioritization gets reinforced. And what this does over time is it reinforces the status quo. So those with power, privilege, visibility set the priorities. So why does this matter in the field of global health? Global health prioritizes the knowledge of people like me. Global health prioritizes people like me. And I'm just going to give you the very quickest, dirtiest history of global health to help define that. The first thing is to know is that global health and public health came out of fighting malaria and figuring out how to solve malaria and treat malaria. And the reason for that is that malaria was a colonial problem. It truly was an obstacle for wealth extraction. So the Colonial Project, this is a quote from a wonderful paper talking about colonialism, malaria, and how to decolonize global health. So the Colonial Project provided the reasons to study malaria. It determined who was in a position to do so, and shaped the knowledge generation and its applications for malaria control, along with, and importantly, the distribution of its benefits. And the beginning of malaria was actually the start of many schools of public health, including the London School of Hygiene and Tropical Medicine. I think you can see that language in there really gives you a hint at what it was trying to do at the time. So what happened over time with colonization? And let's just talk about this. Colonization is not an old thing, right? Malawi, where I lived, was freed from the British imperial colonists in 1953. And so by my calculation, if I got that date right, I think my grandfather had already voted in 7 US presidential elections before a Malawian man of his counterpart would have been voted, or would have had an opportunity to vote in. So colonization is not a recent, or is not a long-term thing. It's a very recent history. And over those many decades and years of it, that helped consolidate wealth in the global north. And so just a fun fact is that actually philanthropic organizations were created so that the wealthy could reduce their tax burden, while allowing them to direct funds to the causes they favor. Again, they get to choose where their money gets prioritized or where it gets distributed. And today I'd like to highlight that resource extraction from Africa continues to outweigh the aid returning to the continent. So a visual around the power asymmetries in global health. And this is of 20 key global health actors in 2019. And these are the 20 key global health actors that the authors identified through lit review. The financial transactions really measure kind of what money passed from whom to whom in 2019. And the line thickness is the amount of money, and the font size is the total amount of money. So all that's to say is you can see here where the big letters are, and you can see where the tiny letters are, all the African countries, and how the money flows in terms of where it's going. And so this is some dramatic foreshadowing. You're going to see this again. But what I want to talk here is about the combination of institutions and organizations and power structures within global health. And so here we have institutions that actually control how the funding is distributed, and organizations that receive it and then redistribute it, per their priorities and per their interventions. So institutions include governments or multilateral organizations, World Health Organization, UNICEF, UNFPA. And then up here in the corner, you can see we have the Bill and Melinda Gates Foundation, which I haven't categorized as an institution or an organization, because in my mind, it's kind of both, right? Right now, it's one of the top funders. The UK, the US, Bill and Melinda Gates Foundation in this diagram are the biggest funders. And so it needs to be on the map. So again, global health prioritizes the knowledge of people like me. And when we talk about knowledge, we also like to use these words epistemology or epistemic. And so it's not just me in global health that's sort of noticing the knowledge is being controlled by a certain few and being prioritized for some versus others. In the last 4 years or so, there's been several really amazing articles talking about epistemic injustice in academic global health, really turning the light to what do we define as knowledge, whose knowledge is prioritized, whose science is lifted, whose is repressed. And a lot of conversations about how to use knowledge in global health, reimagine how we use knowledge. One of my favorite papers is this bottom one, epistemic disobedience. So really a call for how to change what you define as knowledge, and really calling out to individual practitioners for how to change their thinking and actually disobey, revolt, cause a commotion to try to push against the status quo. So this dissertation focuses on how to support global health practitioners in seeing the situatedness of their perspectives, how to consider new perspectives, and how to take new actions. So we're going to go back to my PhD program. And when I started, I read a ton my first 2 years. And as I started reading these new papers, I was like, oh, this question's really interesting. I should ask this about my own work. And I started writing down these different reflection questions from the literature that I was reading. And I read across a bunch of different things, thank you to amazing professors, feminist theory, science and technology studies, critical technology studies, human-centered design. I learned a ton of new vocabulary, but it was really this idea of the matrix of domination that blew my mind. And so I want to go through it with you all today. So the paper is called Black Feminist Thought and the Matrix of Domination. I'm sorry, it's a book. And it's by a Black feminist scholar, Patricia Hill Collins. And here on the right is my first reading of it with my yeses and my stars and my hearts. Like, it truly blew my mind when I first read it. And the reason it is that her framework reveals how oppressive systems intertwine to shape social hierarchies and unequal power dynamics. She defines that there are multiple levels of domination. She calls this the matrix of domination. And these are structured both along intersecting axes of socioeconomic status, race, and gender identities. And it's also structured across personal, community, and institutional levels. So those two things work together to form the matrix of domination. The dramatic moment has arrived. I hope you've seen it. So you can see here the same idea where there's institutions, community, personal of the matrix of domination, which echoes and really mirrors what we're thinking about when we think about power structures within global health, right? So there it is. And this is why this framework kind of blew my mind. So the idea with this is that if we think about, and Patricia Hill Collins calls this out, if you can think about the situatedness of the knowledge of individuals across the different axes and across the different levels, that is how you disrupt or provoke change. And so in our field, we like to think about individual practitioners as having different roles. Some are researchers, some are implementers, like physicians or nurses. Some are researchers, academic or implementing. Some are funders, et cetera. So there's tons of different individuals who make up the matrix of domination. And they're not just like one place, one person. Many organizations are mixed. So you have academics who sit at funding organizations. You have implementers like us sitting at University of Washington, where we're actively implementing programs with partners while sitting at the university. And so Patricia Hill Collins also, calls on examining the situated knowledge as a way to resist and dismantle oppression. And again, this is where my brain like exploded. So like, yes, this is what I've been thinking about. How do you do that? And I think the important part to think about here is that it happens not just by like one thing going. It's not just institutional change or individual change. It's those things happening simultaneously, right? You don't wait for an organization to change. Individuals need to change in order to change communities, institutions, et cetera. So critically examining, what do we mean by that? That's another kind of term that's nice and heavy in academia. We often call it reflexivity, to reflect. In my dissertation, I call it critical reflection, right? So to take a more critical approach to how you're thinking about things. And now we're going to go to kind of the trends in reflexivity in global health. And so here we are in 1995. Between 1995 and 2024, there have been 293 papers written about reflexivity and thinking about reflection. And you can see the big uptick in 2020. Of course, what happened to the pandemic, which got us all at home and thinking, but also the murder of George Floyd, Breonna Taylor, and many other people. And finally, that got into the limelight where people said, whoa, wait a minute, what are we doing? Like, what is this? We need to start thinking about what we're doing and why. And so a big uptick in 2020. The amazing part about the human-centered design literature, just a flavor of what's going on for reflexivity, which is really cool. More recently, a lot of the editors of major journals have said, hey, we need to add reflexivity statements. Like, let's start to ask authors to think about what, their position before they apply or before they submit. We need to think about how we have conversations that are reflexive within groups. We need to have, and I love this paper, the bottom one by Said and Taylor, around how to institutionalize it in academia. So they call out their curriculum that actually asks global health students these really tough questions throughout their training. So whose idea was this? What made this idea worth pursuing? And so that they're constantly thinking about how to critically reflect throughout their training. But human-centered design has a way longer history. So here we are all the way back in 1952. There are 10,000 papers that have reflexivity written in them within the human-centered design literature. And exciting for us, there's a whole body that started in about 2005 about how you actually design to promote reflection. And so this is the part where I saw it and I said, ooh, interesting. We want to question situated knowledge. If we want to think about the matrix of domination, how do we design for that? So this brings me to research question number 1. how can Design for Reflection Scholarship support reflexivity for global health practitioners? And I can't go into the details, there's an entire chapter, again, invitation, but some highlights are there are design principles and interventions, tons of different interventions that have been measured for how to promote reflection. There's a taxonomy for how to categorize the depth of reflection. There are strategies for how to measure transformative learning. And there's also this really cool tool, which you'll see in a bit, that helps measure how well a technology itself supports reflection so that you can compare different technologies over time. One that I'd like to highlight is the strategies for transformative learning, because you'll see it again in the results. And the idea is that you can measure how somebody's knowledge to action changes over time. And it was initially developed for a college curriculum, so a college class. And so you want to kind of start with a student at the beginning of the year, you see how they're doing, you measure it a few times, and you see at the end how much of your knowledge has transformed into action. So an experience of an intervention like a college course causes me to question the way I act, so the bottom stages, make plans for how to change, and then take action. So the higher stages are actually getting to the action where you're integrating new perspectives and practices, whereas stage one is you're grappling with something new and fresh. So I took a lot of this literature and then started to build with some colleagues this intervention that we call the Reimaginator. And so I'm going to introduce the Reimaginator to you all briefly. So welcome to the Reimaginator. This is a space where our global health community collectively learns and takes action. So let's begin. Let's refresh. There we go. Okay, so step one is think about a global health project in your past, present, or future. Now you can choose your role on this project. Are you a designer? Are you a researcher? Are you a funder? In my work, I'll say that I'm a designer because I often design global health interventions with colleagues. And so the question that's going to pop up is from the literature that I read, so from Ghoshal et al. Who is missing from the design of this project? What should change to include them? And so I can decide, do I want to skip this question? Is it confusing? Or am I ready to write my reflection? Let's say I want to skip it and I can get another prompt. So I can kind of think about and play in this random order of different prompts to consider. When I'm ready to write my reflection, I click the button. I can write whatever I'd like. I say, I ask them, based on your reflection, are there any actions you're going to take? Are you going to move towards action because of this? Yes, no, or unsure. And then participants can decide if they want to add their country location, country of origin, keywords. Those are optional, they're not displayed, but they can add that kind of contextual detail, which will help us with research. And then importantly at the bottom here, they can decide whether they want to send their reflection privately or if they want to post it to a public forum. So when they post it to a public forum, it pops out in this connect page. And the connect page here shows you all of the different reflections that have been submitted by other people who have decided to post them publicly. And you can sort and filter by other questions from designers. And I can look at how other people have reflected on those questions. There's also access to a Learn tab. So over the course of this work, I'm trying to pull together any kind of diversity, equity, inclusion resources. There's a ton of them in here, reflexivity, decolonizing design, like all sorts of things, and the sources for all the questions within Reimagine. And then finally, there's this contribute tab. And this one was really important, although not a single question has been submitted. But the idea is that all of the questions so far came from academic literature. And so, that's just one source of knowledge, as we know. And so really to try to diversify that thinking, we wanted to open it up to say, okay, what else do you think we should ask? And I always go back to kind of a grandmother in Nato Malawi, like what would she want to ask, or what have I heard from her that should be asked of our programming to try to incorporate the voices of other people into these questions. So that is a teaser of the Reimaginator. It is open. I think I have it for 2 more years, so it'll be there. And now we can talk about the kind of research into using the Reimaginator as a tool. So 2 research questions come out here. The first one was, how do global health practitioners engage with and perceive Reimaginator for critical reflection? And the second is, to what extent does engaging with Reimaginator provoke global health practitioners to rethink and reimagine their interventions? So what does it look like to use the thing? And what does it do to maybe change thinking or even potentially change action? So recruitment, so recruited through my network, kind of listed 38 different organizations, categorized them by whether they were implementing organizations or funders or academic institutions, emailed some, recruited, and then at the end, we had 4 organizations who said yes. And we really wanted to diversify who we included so that we could get a variety of perspectives on the Reimaginator. So one implementing organization, so an organization that works, it's actually based in the US. There are multiple different country sites. Each country site acts as its own independent NGO, and they implement healthcare programming in all these different countries. And from that implementing organization, leaders from that joined from 5 different countries for that workshop. The second is an implementing research organization. They've worked in one space for a number of years. They've always dovetailed research with implementation. And we conducted the workshop with their research team because they were the only group of English-speaking individuals within that organization. And so that's why we worked with them. We also worked with academics from a global health university, and then a funding organization as well. So those are the 4 organizations who participated. Again, thinking back to this matrix of domination, we really wanted to make sure that we're covering the different institutions, the different individuals to really look at and critique this tool. So for the study, there was a pre-workshop survey to get information about reflection practices before they were exposed to Reimaginator. There was a 75-minute design workshop, and then it's supposed to be 2 weeks later, but people responded about 4 weeks later to a follow-up survey. And in this, there were these are the 30 participants and how they were distributed across. And then here are the follow-ups. Only 23 of the 30 followed up, and you can see these little what guys are going to be the people who did not respond. So 2 came from the implementing organization, 1 from the implementing research, and 4 out of the 6 from the funding organization. So during this workshop, participants used the Reimaginator for 15 minutes. They only used the respond to a reflection question. They filled out a 10-minute individual survey. Then we had group feedback on the Reimaginator where we talked through it, had a few prompts for them to go through. And then we went to the speculative design where we actually had the participants pretend that they were fast forwarded into the future. Their organization was doing reflection, was working well. We didn't define what that meant. And we asked them to speculate or to tell us what it actually looked like in practice. So to really think in the future of what a successful integration of reflection would look like for their specific organization. So results. I'm perfectly on time, so I'm very excited. Okay, so how do global health practitioners engage with and perceive Reimaginator for critical reflection? Kind of the boring one, I guess, is they engaged with it as we expected. So how I categorize the organizations tended to reflect how participants, which roles participants selected. In other words, you can see at the bottom here, of the 126 questions that were answered, for the funders, most of them chose the funding role when answering questions. Or from the implementing of the 31 reflections, most often they chose the designer role when choosing which role they were on the project. There's an average of 4.2 questions per person answered in 15 minutes. We did not collect identifiable information, so I can't tell you precisely, so it's just averages, because we didn't want to actually collect any identifiers or patient IDs on the Reimaginator website. What's important to know is that 61% of participants reported that they wanted more time and that they would like up to about 30 minutes. Although some said that, at first they might want 30 minutes and that over time it could reduce, or depending on the project they selected, if it was at its early stage of development, they might want more time versus later they could use less time or vice versa. This is one of my favorite facts. Okay, when they got to choose if they wanted to post publicly or privately, 81% chose to post privately. So across the organizations, I think the implementing organization was kind of the most likely to post publicly, And then the academic organization, 100% of the reflections from the funders were posted privately. And so what do they share when you ask them about this? Those who shared their responses mostly publicly said, my response might be valuable to someone else. There wasn't any sensitive information, like I'm happy to share it. Those who posted privately said that this is fascinating. It allows for unpolished reflection without the pressure of public scrutiny. So even though this was posted anonymously, which maybe they didn't gather from the tool, it was a quick look. Even that, it felt too nerve-wracking to share it, and fair enough. They were also uncertain about the correctness of their reflections. Their reflections maybe contained some sensitive information, or they didn't want to bias others or accidentally cause harm through their reflections. So there was a lot of timidness, if you will. It was a little bit scary to do this, and this will come back in a little bit for kind of how to motivate or how to change and try to make things more comfortable for global health practitioners. So perceptions. Now, how did Reimaginator support reflection? This is a tool that's used. It's called the Technology Supported Reflection Inventory. It measures how design interventions or technology interventions support reflection. It's pretty new. It's been validated, but it measures it across 3 different categories. Insight, so whether or not the tool offers a participant new insights. Exploration, like is it easy, is it enjoyable to use? And comparison, can you compare your answers to others, as a critical part of reflection. Each one of these was measured in a 7-point Likert scale, from strongly disagree to agree. These are the messy findings, so kind of looking at the median of each one of these findings, but I made it nicer for you all to look at. So when we go to the things that were more positive, the Reimaginator, I should say, kind of somewhat supported thinking in new ways. There was the strongest thing of people enjoyed exploring using the Reimaginator. They thought it was relatively easy to see a variety of questions, and they said that they would like to discuss their experience with colleagues. Some of the more negative things is, it didn't change how they approach their work. It does not give ideas for how to overcome challenges. Again, this is really important for thinking about future design. It does not make it easy to review responses, doesn't make it easy to compare responses, and it doesn't make it easy to discuss experience, or few said that they were likely to discuss their experience with leadership. So interesting, they were willing to maybe talk about it with colleagues, maybe a little bit, not so much with leadership. And then in terms of these kind of comparing responses and making them easy to review, that came up again for a really important tool when designing for reflection. And I'll talk about that in a few slides. So perceptions, would you recommend using Reimaginator to colleagues? The answer was maybe, no, little bit skewing to likely, but not a super strong, yes, we love this tool. There was a huge split across the different types of organizations. So implementers and implementing research organizations were much more likely. Funders and academics were less enthusiastic about it and recommending it to their colleagues. 3 people, actually, at the end of that 4-week period, reported that they shared the Reimaginator. So of all 30 participants, only 3 shared it with their colleagues at the end of the 4 weeks. So not very much recommendation or use. And in fact, there's been no new reflection submitted since we held the last workshop. I just looked today. The next question around perceptions is, would you use this in the next 2 weeks? Unlikely. Again, kind of drives that nobody was using it, and they weren't as excited. Again, funders and academics were less likely, and implementers thought they were a little bit more on the neutral side. And then 6 people did report using the Reimaginator at 4-week follow-up, but again, nobody submitted new reflections. So whether or not they were just browsing or whatnot, but there wasn't any public or private posts submitted. All right, so research question 3. To what extent does engaging with Reimaginator provoke global health practitioners to rethink and reimagine their intervention? This is, remember, those 10 stages of thinking about and planning and doing. Again, invitation to read the full dissertation. I'm just going to go through 3 of them now because I think they're really interesting findings. So the first is that stage 1, all the way to the left, the disorienting dilemma. So using Reimaginator caused me to question the way I normally act. Again, less than half said yes. So it really wasn't by this measure really causing them to question the way that they act. Although research and implementers were a little bit higher, and same with academics. None of these are statistically significant. I should say this out loud because it's a really small sample size. As a result of using Reimaginator, step 4, I realized that others also questioned their belief. At baseline, 36% said yes. And at follow-up, 57% said yes. So really, really curious finding for me. And so I remember right as they took this survey at the end, they had just used the Reimaginator for 15 minutes. They just did the individual survey. And they reported to us, as you saw in a few slides ago, that they weren't able to compare their responses. So how were they able to realize that others were connecting, right? They were just doing it on their own. After that individual part, we did the group feedback part, where we talked about Reimaginator, we did the speculative design, there was lots of conversation. And so my thinking here is that this suggests, and this was reflected in kind of the qualitative data in conversations with participants, that the group conversation piece is a critical element, and that it really did help them see that their colleagues also question their belief. In other words, start to create a sense of community, so you're not so alone. As you're sitting there kind of really nervous about your reflections, this actually creates a space to say, oh, other people are also thinking about these things too. Finally, as stage 10, as a result of using Reimaginator, will take action and adopt new ways of thinking. Right after doing the Reimaginator, 54% said yes. And at the end, only 14% who said, or 14% of people, so only 4 participants said that they had actually taken new action within 4 weeks. This is, and 57% said no. This is also not surprising. I mean, the pace of interventions, the pace of change is really, really long. And so how could we imagine that a 15-minute intervention would stoke some change or really make people take different actions or adopt new ways of thinking? Another important thing to say, though, is that we can't attribute all of these changes just to Reimaginator. Other interventions could have happened, different things could have happened within the participants' organizations or themselves, et cetera. But in short, no real spark to action. Would you recommend that your organization adopts it? Yes. That was for all the 23 participants, 97% said yes. However, and I love this quote, integrating into organizations is really, really tough. And this participant from a funding organization says that we have a pretty extensive process. We do have some reflection tools baked in, but the effort to change their processes is quite Herculean. Important to note some barriers to reflection, and this one is super critical, is several participants noted the lack of psychological safety and feeling comfortable sharing their reflections with others. And so this particularly came out in the academic group, where they said there's a ton of different risks that we could have: job promotions, funding access, that there's a ton of personal risk. So that being vocal about our critiques about global health or our own failures or our own things we're questioning really opens you for risks. And then there's another piece around just time and other work priorities. And I love this quote. As one academic described it, I'm being always too busy to think, right? So it's just really, really hard to get that space to step back. All right, one of my favorite findings, I'm going to go just a couple minutes over, but I'm almost there.
You have 7 minutes.
Oh,
We started late.
okay, sorry. I was looking at this as my head. Oh, okay. This one's so cool. Okay, so at the end, we asked the 23 participants who responded to the follow-up survey, if you could choose only one organization to reflect, who would you choose? And I split this out. So implementing organization, researchers, academics, and funding. And you can see that these guys are the ones who didn't respond. So we don't know from those organizations where they would have gone. The ones who are touching themselves are those who said, actually, my organization, I would say that another implementing organization is the #1 role I would choose, right? And then you have others who say funders should be the ones who reflect. And you can see all of the academics say funding, all the 2 funders who responded said leaders and researchers, et cetera. So you can see kind of the breakdown here, and I'll show you this in a couple of different ways. So when we go back to the matrix of domination and we think about critically examining situated knowledge and how that needs to happen along intersecting axes and levels to make change, it comes into this kind of reflection, right? We need to look back and look at ourselves. And that's the goal of a tool like Reimaginator, is to give an individual a tool to kind of poke at and think about their interventions and their work in new ways. But what do we see in global health? Of the 23 participants, well, I should say, sorry, of the 30 participants, 20%, so 6 said, yep, I would nominate my organization. We're the ones who need to do the reflecting. 7 people didn't respond, so we don't know what they would say. And 56% are pointing. And who are they pointing to? 12 of those 17 are pointing to funders. And this makes sense. This is no surprise. And this is no surprise for a couple of reasons. I think one, I should just note that the 4 people from the funding organization didn't respond, so I don't actually know where they would go in this, and that could really change things. I'd be very curious to see if they're here or if they're here, we don't know. The 2 who did respond were actually pointing to other people, or pointing to other organizations. But this is important because of that matrix of domination framework, right? Academics are reliant on funders for the work that we do, right? And so there's so many entanglements here that we say, oh, in order for the system to change, I need the funding mechanisms to change. I need there to be more equity in these practices, how you select grantees, et cetera. And so I think that that's like the big piece. It's no surprise because of how much money and power are tied to priorities. And if you don't have that money and power, it's really hard to set your own priorities. Key limitations. Really importantly, participants do not reflect the diversity within global health. Most for leadership roles within their organizations. We intentionally recruited leaders because we wanted to kind of find the change makers, those who do have power within their organizations to make change. But there's obviously so many other people who should be involved in this work. 97% had graduate degrees, 50% were from North America. There were no participating organizations from governments or multilateral organizations. Tiny sample size, for all my public health folks out there, these sample size mean trends, not significant differences. This is really important, but we can start to see the inklings, the flavors of this work. Additionally, we were just measuring a single session intervention. There was an insufficient dose, just 15 minutes, really limited exposure to reflection in the tool's features. There was only 4-week follow-up, and we know that change takes longer. The learning activity survey itself, the one that does those 10 categories, really uses yes, no, and unsure responses. So in my mind, that really limits the measuring of kind of more granular, smaller changes over time. It really kind of forces people to make the yes, no, unsure. And for me, when you kind of are pushing a yes, it risks social desirability bias. So even our yeses could be overstated. I think particularly given the field's trajectory, that somebody might feel more pressure to say, yes, I'm changing my thinking. Yes, I'm planning to take action. Yes, I'm going to take action. And so I really wonder if like a Likert scale or a different type of scale would help us get at more granular changes over time. Key contributions. I think the first one, which you've seen kind of over and over again, is I think what I see is the importance of the matrix of domination and helping us understand, describe, dissect, look at global health. And I was reassured because I just recently came across this in September. Is this amazing book published called Rethinking Global Health: Frameworks of Power. And in it, the clinical psychologist, and she calls herself an activist, uses the matrix of domination to actually dissect the power structures in global health. And she also used it to do a phenomenal case study about Haiti and the kind of power structures and imbalances that are happening there in terms of global health delivery. In her book, she says, power is about law. No, it's about the patriarchy. No, it's about economic and financial and resources. No, it's about ideas. She says, no, power is loud. No, it's quiet and invisible. It is never conceded without demand, and it's available to all of us. In other words, really calling at the idea that it's individual responsibility to shake out and see what you can do in terms of critiquing your situated knowledge and kind of owning the powers that you can change. With this, another contribution of this is actually applying the matrix of domination to design this intervention. So there was a real theory of change. Individual reflection might change in teams. You get more collective dynamics, provokes organizational change, and then reimagine institutions. Prototyping the intervention has some evidence of provoking change, and we have many ideas for how to better support design for reflection for global health practitioners. I can get into these in the Q&A if you'd like. And key contribution number 4 is that we have now some theories and tools, similar to behavior change theories within global health, but for this audience of reflection to action, and really thinking about those interventions in measuring the changes. So with that, sorry, this is messy. Future work is that I'm finishing my dissertation. This is not the slide I prepped. I'm working to disseminate these ideas. So again, this is the first time I've shared it publicly. And I'd like to have a lot more engagement, a lot more reflection on it, more workshops with speculative design, and to kind of gather and share more resources. I just want to take a moment and dedicate this dissertation to Mitch, who is a dear friend to many of us online and in the room, who passed away unexpectedly. So yeah, my heart goes out to him and his community, and thank you for everything you did, Mitch. And then I'm just going to breeze through these acknowledgements. You all are here. You've been tremendous support. Big shout out to my committee, and I have to say thank you to Beth for helping organize and distill all my wild ideas, because there's a lot of them, so thank you. Many thanks to the Department of Human-Centered Design, my cohort, my mentors, amazing dissertation team, participants, like unbelievable insights. Thank you for sharing your time. To the research team, Purva, Dr. Raquel Sanchez, and Natalie Sopizio, thank you for helping design this intervention, think about the workshops, and just spend 9 months kind of putting this through the ringer. To Alejandro Ruiz for spending 3, aka more than 60 hours actually building the Reimaginator, thank you. And then to a number of other collaborators whose ideas have really stoked this. They've read my work. We've had conversations about things. You've shared a great deal. Yeah, I just could go on and on. Of course, thank you to my family, my partner, aunts and uncles, all of you, and my chosen family. You all know who you are. And then I just have to say, because there's so many of you on the line, thank you to every single colleague that I worked with. I truly gained so much from learning from you, with you, beside you. You really have forever shaped my brain. And so I just, yeah, thank you. So these are all of the folks in the Children's National Medical Center, the CDC, Partners in Health, and the headquarters office in Mass, and my current colleagues in Seattle. Okay. Sorry, yeah.
I know you have time for discussion, so
Thank you. I appreciate that.
thank you. So I'd like to open it up to the room and to online for any questions people may have.
Just trying to put you on the screen. Oh, thank you.
Any questions from the room?
Yeah, but I'm excited for this. I've been watching you work on this for the last few years, and so one of the things I wanted to ask, was if you could tell us a little bit more about your design workshop, your decision to do a design workshop versus an unmoderated usability test with you Reimagine. What was your purpose of actually doing something that's super involved with versus you could have built this and just deployed it and waited for feedback to come back. Yeah, how was that workshop experience for you, and why did you decide to do it?
Yeah, great question. I mean, I think putting it out into the wild is very rarely just going to spark. I thought maybe it would spark a bunch of engagement, but the design workshops were really critical to talk about it. And I think, I've seen a couple of papers thinking about kind of how to support reflexivity and different things, but I really wanted to come to this individual intervention. What do you think? And so being able to kind of selectively choose different organizations, obviously 10 of them responded, and I think 6 of them said that they're interested, and 4 we could schedule. But it really did allow to get a different perspective and really see kind of what reflection might look like for a funding organization, what it might look like for an implementing organization. So I think, yeah, just the conversation is key when designing any of these things. And I think a lot more co-design could be used. And I think we had wanted to do more co-design, but we limited it to 75 minutes. People are so busy. And so really it was look at this tool. What do you think? What else could we do? And so I think there's a ton more work to do in terms of actual true co-design with global health practitioners. Thanks. Oh, another question.
What happens to the responses that were submitted by are those being analyzed?
Yeah, great question. So we can access them. So the participants knew that. We said, oh, the researchers can access them. We actually haven't done any content analysis on the reflections themselves. That is a big part of future work. in that, you know, through a lot of the mechanisms within the Design for Reflection scholarship, there's ideas about how to measure depth of reflection, or even think about how to categorize a question in terms of the depth of reflection it provokes and maybe guide people that way. But in short, we can see them, we're sort of counting them as numbers now, and then it's a huge kind of wealth of future data that we could analyze.
Got a couple answers.
Oh, sure.
Based upon your experience creating this and the feedback that you got back, how would you say, like, in your wildest dreams, like, how did this tool move forward? Would it change much? How would it be implemented or not?
Or not, yeah. Oh, yeah. In my wildest dreams, let's say I have funding as unlimited, what would happen with this thing? And what would happen with this thing would be, and this came from the participants, it needs to be way more culturally adaptive. There's several French-speaking, participants really, we really want this in a different language. There was a lot who said, hey, this tool is really framed in like US DE&I decolonization, like this doesn't resonate with us. So it really needs to be a lot more culturally sensitive. But I think the bigger thing that came out, and the thing that I'd like to see, is kind of through the matrix of domination, change will happen with institutional commitment, dedicating resources, and really thinking about how to embed this. And so in my wildest dreams, we actually figure out how to develop tools that can be used within teams, within organizations that aren't so Herculean to implement. And I think, yeah, right now, I guess my dream for Reimaginators that just gets shared, and that people critique it and poke it, and that we can kind of think more creatively about how else we can embed it into practice. Oh, the final thing I'll say is a huge piece about that the participants shared, and I love this. They had so many cool design ideas. One of them was, hey, we want more actions. Like if I write this reflection, what is somebody who's answered that same question, what actions would they take? And so they said, first, have us write out what actions we would plan to take. Second, what if you showed us those actions as soon as I responded to the same question? What if you popped up what other people said? Oh, that's really cool. And then they also said, we really want more tools and resources. So clearly they probably didn't have time to look at the tools and resources, and it's just a giant like mess of a library. So really thinking about how do you actually connect two different tools and resources. And so another hope for Reimaginator is that we continue to diversify the resources and share them. There's an amazing tool on there. I'll shout out to Path on their like equity assessment for their projects. And they actually do this kind of couple-page document on each of their projects to assess equity over time. It's equity benchmark, that's what it's called. So anyway, there's lots of really cool stuff, and my hope is that we can embed it into practice and continue to grow practices and research them with the tools that we kind of outlined today. Oh, and sorry, I see Annie has a hand up online, so let me.
Yeah,
Hi, Annie.
everybody. Hi, Beth. Great job. This is really fun to see all the amazing work that went into this. And I feel like I want to have a longer conversation with you at some future point, but one of the major things that stood out to me was the sort of that differential between how many other people that were participating in this saw sort of their goals around funders interacting with this versus, you know, there was even lower participation among the funding organization, even in just completing the survey, and also not self-reflection of like, oh yeah, we should use this. And I think that that's sort of like you said, that's where the rubber hits the road, since the resources come from the funders and they have a lot of centrality in what can be done. And so I guess I'm wondering if you have any thoughts about, are there ways to get funding agencies more engaged in this kind of reflection, and what would that look like?
Oh, great question. Thanks for calling that out. Yeah, so much to say. Okay, first, yeah, I think you're right in terms of reluctance. Even in the workshop, there was a lot of like your tool, your thing, yours. Like it was really kind of, the language was really like, it's your thing, not ours. And then even, you know, in the discussions, it was like, oh, like we're probably not likely to use this tool. This could be useful for other people. So in short, like this tool didn't resonate with them. It didn't meet their needs. They didn't see it as something that was critical. I don't know why. Like that's the piece that I didn't study, we didn't get into, and it warrants a lot of looks. In terms of engaging funders, ooh, that was hard. They were a group that I was trying to engage with. I won't say the most, but I definitely poked almost all the kind of my network of funding peers and organizations to try to get to different leaders. And I only had one response, and it took months. it's really hard to get in the door. And so part of my thinking now with kind of engaging funders is you know, through academic literature, through the things that they read, through hopefully maybe some leaders of these different you know, groups tuning into this talk. But yeah, I think there's a lot more design work to be done, and there's a lot more engagement that needs to be done, because if we're all pointing to them to do reflection and they're saying this isn't for me, you know, what tools would resonate really, you know, what practices are happening within funding organizations that can be shared. And there's a question in the chat. Are there any questions here? Others that can read Megan's. Oh, okay, so the question in the chat from Megan Coe is, I often think of reflection as an individual activity and for individual learning. It's great that this tool starts to turn reflection into community and group practice. Do you have thoughts on how you would build that build that individual group connection in the future? Yeah, I mean, I think from the participants, they want to see like more of a group discussion guide, something that they could take with Reimagine being a tool they use individually and then come back together. That psychological safety element is key, and so really thinking about how do you get buy-in from leadership around that. And then, yeah, I mean, there's so many different ways. We thought about kind of opening up Reimaginator so that you could respond to somebody else's feedback or give it a like or not, and then kind of through peers at HCDE, it was like, oh, the comments are really hard, and how do you moderate that? So there's lots of different avenues for how to kind of build that, and I think we'll have to look to global health practitioners to kind of see what they'd like and what would be useful. Sure.
So you had this sort of progression in the dissertation from you look at all these theories for what kind of design features can support reflection. You then built them into the prototype, which in some ways could be like the hypothesis of like, this will work. And then you saw what happened. And I'm curious if there's anywhere that you saw, like reflecting back, that, gosh, these features that theory says should work didn't seem to work out that way or went different. I'm also curious about the successes, but I think the gaps are actually in many cases more interesting.
Oh,
I
totally.
have the same question.
Yeah, I love that. Okay. So one of the things that I did in the Reimaginator was I kind of pulled this idea of poetic ludic design, so playful design. And I really wanted to make it playful to feel accessible, because right now I think we feel reflection is like a little bit scary. So I was like, how do we kind of lower the temperature? So I made this like playful design, and the idea that I had was like a magic 8-ball. You've seen those things where you pick it up and it delivers it, like magically appears the question that you're supposed to think about. And so within the design for reflection literature, there's ways to categorize depth of reflection. And like my thought initially was, let's categorize the depth of the reflection questions. Do I think this is going to get you to critical reflection or just like, you know, beginning thinking? And then from there, we could order the questions so that it would kind of let it build over time. And then we were like, oh, we want people to see all the questions in Reimaginator. So we debated this a while. We said, no, let's make it more like the Magic 8-ball, just a random question here. And what participants said was, this thing feels like chaotic. Like, I don't know what you want me to do. Where's the huge list of questions? I would rather choose which questions I want to answer, which would be cool, but it also might limit the kind of novelty effect or the things that are actually going to poke them, because they could just choose easy answers. So I think that piece of me kind of in the playfulness, like didn't feel as playful. It felt, yeah, it felt like too much. And I think it can be back to kind of how to tailor design culturally. A lot of people wanted more, not culturally, but just in general, people wanted more of a hierarchy and more of a stepwise manner. And so there's a lot of cool ways that we could build that in, building like sets of questions, building different things. But yeah, so ludic design and playfulness was not as strong of a hit.
I get another.
Oh, Jay. Are there any other questions online? I'm sure we'll see it all. Jay, did you have a question? You're it.
Question sort of a piggyback on that. You mentioned that the participants felt uncertainty about being correct in their reflections, and also that they also desire a little bit more tailoring towards, like, you know, less of a decolonization and to the questioning. Is there any way to sort of evaluate the responses and whether or not they were correct and what would correct mean in this context? is there a way to remain control of feedback? Is there anything that came out of the research that provides an answer towards what that would be?
Yeah, good question. Like, I think in terms of like correctness and analyzing, so you can see I intentionally like didn't want to get into that. I didn't really want to like evaluate the depth of somebody's reflection. And when I looked at, there's a huge kind of lit review of this, and there are some tools that can do that, but it's really, really hard. It takes a lot of qualitative work. And so part of me, yeah, I mean, the learning activity survey was one way to do that just kind of gauge the level of like self-reflection that they would gauge them at after using the tool. But I do think it warrants like, yeah, another layer of like looking at what people are saying. There's a really cool kind of levels of reflection taxonomy that kind of goes from like, are you basically describing an activity? Like, are you just retelling what happened? Or are there 4 or 5 different levels? And the last level is, are you critically reflecting? Are you bringing in ideas from other places, like political things or social things? Are you like engaging in that level of depth? So there are some tools that can be used, but that's a whole other dissertation, I would imagine. But I think worth doing, because it's like, what does depth mean? Is there like some dose response to you're a deeper reflector and you take better actions? Like, we don't know, we're kind of making those assumptions that if you're thinking hard, you'll make the change. But yeah, there's a ton of research to be done. And even in this, you can see that people reflect, but they say like, we're going to act, and then, it's hard to do.
Time for maybe another 2 questions.
This is a bit of a bad question, but in terms of, you obviously went through and put in a whole bunch of prompts into the Reimagine. Is there one that stands out to you as one of your personal favorites, or something that you will reflect on in this process?
Gosh, there are. It's not going to come to me right now. There are definitely some. The one that's really coming to me is that's what it is. Okay, so it actually was from my critical technology studies course, and we listened to a podcast on carceral technologies. And this kind of activist raised, what are your commitments? Like, what are you committed to? And so that question really got me, and in that feminist theory course, after reading all these papers, I was like, what are my commitments? Like, what are the things that are driving me and why? And I think that was like really the beginning of this evolution to start to unpack things. I don't think that what are your commitments is included in Reimagine, or it should have been, but we had the researchers reviewed every single prompt, and they got to that one. They're like, what do you mean? What are your commitments? And so that one got kind of tossed out. But yeah, that was one of my favorites, is to articulate why you're doing what you're doing and what are you committed to for that reason.
Yeah, we got time for both.
Okay.
I think one of the things you kind of mentioned was that like some of the participants or practitioners wanted to have maybe more ways to communicate with each other, even though they use the tool. So I'm just thinking maybe just like an idea here. And you feel that like maybe some type of like social media or online meeting component would be like a maybe suitable way to, I think, have those conversations, given that some of these people like don't maybe work together or within the same organizations, but want like a more situated space for that.
Yeah, great question. My first thing that's going to come to mind, I think Emily Rose on the phone, is WhatsApp. We actually wanted to do a study at one point about the health impacts of WhatsApp, because it's so predominantly used across communities and across global health practitioners. And so, I sort of wondered, and we did this in Malawi, when we were kind of rolling out a quality improvement initiative across a bunch of different districts, we tried to connect people on WhatsApp so that even though they maybe never met face to face, they could ask each other questions within that space. So I feel like WhatsApp or those kinds of forums would be great. Again, kind of the moderation support, but maybe there's more free form, non-hierarchical ways that you can connect people. So it's definitely worth talking about. I will say too that practitioners are hungry. Like, I think in general, everyone's like, yes, we want to reflect, yes, we want to do this thing, at least in those who opted into the study. So there's bias there probably, but they want to do it, but they also want to know what changes to make. And I think it can feel overwhelming. to kind of look at this big structure and say, what am I supposed to do? And so I think, you know, some sort of group cohesion, as you saw, seeing that others are also grappling with these things, is a critical element to kind of also helping you connect to resources to make changes.
Last question.
Okay, yay, great job, this is wonderful. Kind of in a lot of lines, I was thinking about, how you might think about incentivizing these groups to get more buy-in to do it, and something that I'm hearing is they're hungry for it. But is there anything that, you know, in the literature or otherwise, thinking like how people can be motivated to take this besides the reflection itself? Whether it being tied to, we know, I remember seeing this a long time ago, but as far as international development and global health funding, the US is some of the most inefficient when it comes to their dollars spent. Like what gets people to see reflection as even like part of, not beyond like a intrinsic value, like I want to do good, but like this would make us a better working organization, this would make us a better use of these funds and more stewardship or something like that. So I'm kind of just thinking if you had thought about how you would get more people to see the value in it. There is a lot of value, of course, but
It's a good question. Actually, it's something when I was doing all of this, right, I was like, oh, it'd be interesting to ask more questions about what do you think the value of reflection is? I didn't, and I'm like, oh, what are those things? In terms of like embedding into practice, some interesting things actually. So we saw a lot of the East African participants that they reported reflecting the most during performance reviews for professional development. So that was really motivating for them. Like that was the time that they like stood back and looked at things and felt that there was an opportunity to do that. And I feel like a lot more of the North Americans, it was honestly, it was just a lot more of like, am I doing work? Like, is this a good idea? Like, should I be? It felt, I mean, again, this is a little bit of generalizations, but that's sort of how it felt. So I think in terms of looking at the motivations for doing it, I think it has to be embedded into what we do, whether that's applying for funding, writing reflexivity statements, job performance reviews, project reviews, and even in like my work in global health, we do have periodic reviews to look at performance, but often we're looking at budget and timing and health outcomes. You know, we're not fully getting into the weeds of like what would we want to tinker or change to make this more equitable or whatnot, because it just things move fast. And so in short, there's a lot more work to be done about what motivates and what people value, because that's the place where you want to try to intersect.
Great line to end on.
Yeah.
So, thank you. Thank you all for coming and for great questions. I'm going to invite you to depart. Thank you, everybody on Zoom. It's great having you with us. Good. Okay.
Love you guys.